to Africa. There are certain regions, counties in Alabama, Georgia, and Mississippi that are one-to-one, male to female testing positive now, which also looks a lot like Africa. But in addition to that, almost half of all the HIV/AIDS cases in the United States are in the South. We get about 19 to 20% of the resources that go to HIV and AIDS in the country. That's where a part of that problem lies. We also have the fact that while we're demanding from all of these other countries that receive funding, that in order to get funding from the U.S. government to treat HIV in your country, you have to submit to the federal government a full national plan. How from every sector of government and operations you are going to respond to this epidemic so that we can figure out what your targets are and give you the funding appropriately. We're demanding from all of these countries something that we have never had ourselves. The United States does not have a national HIV/AIDS strategy. And so it has become really important for us to have one so that we're, not as hypocritical as we usually are. And that not only that we just have one, but that it is representative of the expertise of people living with HIV and people who've been serving women and men and youth living with HIV for the 30 years of this epidemic. And that plan is responsive to all of that. And so if we didn't have, I just have to say this is it's hard work, but this is a little bit about what winning looks like, if you call it winning today, right now. We're gonna give them a few more years. But if we didn't have a current president like Barack Obama in the House, in the White House, we still wouldn't have a national AIDS strategy because we were not able to get that level of commitment from anyone else. But that strategy is moving forward, and it's important for us to pay attention to that. The last thing, because there's so much in it, but the last thing that I think is really, really important is what we have not yet latched into, which I think is because we don't see ourselves as being a part of ending abject poverty in the United States. So when the U.S. signs on to the MDGs, it's because we're concerned about poverty everywhere else, not because we're concerned about poverty in the United States. So with that regard, it's been a challenge for us to actually be able to convince the powers that be and the donors that have to work with us to figure out how to integrate a lot of these other, we may not even call them MDGs, but some of the same goals that are in MDGs for our own communities. And an example of that is we have a program office and a project in South Africa that actually looks very different from what we do here in the U.S. In the U.S., we're very heavy with the service delivery and service provision and all of that kind of stuff. In South Africa, we were really clear that to get to the issue of HIV and AIDS, first of all, women needed agency, needed to be leaders in their own communities where women are not, even though they're leading, they're just not seen as leaders, right? Mostly because we do all the work and get it done. And so that's how we lead, right? Get it done, but we're not seen as leaders. But the problem of economic dependence and the lack of economic self-sufficiency really is the key driver around HIV/AIDS and adverse reproductive health outcomes, right? And violence is a really big part of that in terms of the gender dynamics in that country or in the world for women. So what we decided to do is, folks on the ground know how to talk HIV and sex to their own population. That's not our issue. We can do that with our folks at home. What we can help figure out is how to create frameworks so that what happens organically and with power on the ground, they have the resources to do that. So the project that we came up with is we formed a cooperative of 3 women's AIDS organizations who are delivering services in the community but not getting the funding that the men-led, women-run organizations are getting, is how to help them sustain the work that they're doing. And so we created a cooperative. We worked with the Department of Land Affairs in South Africa, took over 2 years, but eventually worked through the land reform system where we transferred a farm from the white farmer into the hands of this cooperative that's run by these women. And so we now run a 700-acre dairy farm that's intended to generate nutrition, one, but also income for those organizations, and create jobs and income for the people that they serve. Because the cooperative is those 3 organizations and about 66 individual people who are either volunteers or receive services from those organizations. So they all now collectively own this farm. The land is back in their hands. And even if there's not a whole lot of income yet, the sense of agency and the ownership in that drives these women and those organizations and the women they serve to treat themselves differently, to be more preventive, to be more vocal, to be more engaged, and eventually develop economically. So that's just a bit of what the state is and what some of those policies are, how we use the land reform policy to address HIV/AIDS. I think that's kind of cool, and some of the things that we can